All right. Hello, everybody. Good evening or good afternoon. Good morning from Singapore, where I am right now. My name is Santiago Brandt, and I will be your host for today's webinar, Neuroscience for Wellness Practitioners, Mental Wellness Practitioners, I'm sorry. And first and foremost, I want to thank Kelly Philly from Successful Practitioner, Dr. Heather Engram, and Naomi Ross and In Mind Out for making this possible, for helping out with the presentation and helping out make this happen and make it a reality so we can meet today. And if you're here today is because you're a mental wellness practitioner or you know somebody who's a mental wellness practitioner who has some level of experience with neurofeedback, biofeedback, brain mapping, or you are interested, you've heard about neurofeedback, biofeedback, and brain mapping, and you would like to incorporate that into your practice. Couple of household items before we start. Please make sure your microphone is muted and your camera is turned off. And if you have any questions, please feel free to type them on the chat. We'll address them at the end of the talk today. And without further ado, let's get started here. And I'd like to start the presentation with some learning points for you today, things that we want you to learn and hopefully take away from today's talk. One of them is how early life experiences shape and rewire the brain, how neuroscience supports and strengthens counseling and psychotherapy. So we're not here to promote one over the other, rather how the neuroscience and what we do with biofeedback and neurofeedback can support, can reinforce, can strengthen, can optimize your already successful counseling or psychotherapy practice. We will talk about QEEG brain mapping, so you will get a bird's-eye view, a flyby idea of what brain mapping is, but enough to capture your interest. We will talk about psychophysiological stress profiles and why I, as a professional, believe they're important to incorporate regardless of your intervention modality. And then why combining brain training with counseling and other forms of therapy is always more powerful. These learning points are based on my experience as a therapist when I started 16 years ago. And then after I learned about neurofeedback and got into this really wonderful world of neuroscience. So it's drawing from my experiences, both also my success and my failures. And this is what we want to present for you today. Now, I always like to present this pyramid here, and it's about the clients that we see. If you work with psychotherapy or hypnosis or even neuroscience, even with neurofeedback, more than likely you will have your clients present at different stages in this pyramid. Normally, the client will have childhood experiences, adverse childhood experiences, or what we call childhood trauma. This childhood trauma could be prenatal, before they're born, or pre-verbal, even before they learn to speak. And therefore, something happens along childhood between mom being pregnant with you, you being born, and then growing up. Something or some things happen, and that leads to a disruption in your neurodevelopment. You're not the same person after that. You're one person previous to your trauma, and then you're a different person after the trauma, regardless of your age. However, this impact is stronger during childhood. And that leads to social, emotional, and cognitive impairment because you're not the same person. You lose your ability to successfully and in an adaptive and healthy way navigate through the world, to cope and relate with your environment. And that's when you start having problems with your personal relationships, in your marriage, at work, with your friends, with your neighbors, essentially with the people around you. In my experience, most people will show up to our practices when they're higher in the pyramid, meaning they already have years and years and years of accumulated social, emotional, and cognitive impairment. And that's when they seek therapy. So they, for a long time, they thought about it, and for a variety of reasons, they didn't seek the therapy, and they come to see us. and they expect us to do something razzle dazzle and make them better. Well, the tools that we use can make them better. It's just that we need to consider how and how long it would take. Now, the first thing we need to understand then is how adverse childhood experiences affect the brain and the body. As a neurofeedback, brain mapping, and biofeedback practitioner, it's quite unbeknownst to me, it's quite worrisome to me why brain mapping is not part of every single mental health office today. And I say that not because it replaces psychotherapy. I say that because it's a tool that can make your psychotherapy more successful. Because we have now the technological ability to look at your brainwaves and understand how your brain works and understand how your life experiences have affected your brain. And if we have that technology, then why are we not using it? Now, you don't necessarily have to use it directly. You can outsource the service, but you can have the technological tools available. And there's a variety of prices in terms of technological options. You don't have to invest hundreds of thousands of dollars. You can do it for a few $1,000s and run a more successful practice with this in mind. But the only way you really understand it is by looking at it. And the only way you look at it is using the technology. So you probably heard about the HPA axis, the hypothalamic pituitary adrenal axis, and it's the foundation for the stress response. Every client that comes to your office will have different degrees of variation. They're going to be affected in varying degrees in their HPA axis. And therefore, it's important that you understand this sequence to understand how that relates to your client's behavior, demeanor, and also their prognosis, how likely they are to successfully self-regulate and heal and empower themselves. I have found in my experience that many mental wellness practitioners are not aware of this model. And it's not a crime to not be aware. My job and the job that we have with In Mind Out and Successful Practitioners is to bring this to you so that you're aware of it and you can learn to implement it into your arsenal of tools. But in essence, every stress response activates the HPA axis in varying degrees, and you will have clients who come with a lower degree of severity to their conditions, and you will have clients who come with a higher degree to the severity in their conditions. And that has to do with the HPA axis, how their system is coping with the physical and psychological stress. And this is something that you can intervene on in a multidisciplinary way. And certainly the technological options that I'm going to present today offer a large part of the solution to this problem. Now, the HPA axis will be related to neuroinflammation. And one of the goals that I have as a professional is to spread the word, the gospel, if you will, on neuroinflammation. I believe that every single mental health practitioner around the world should be neuroinflammation informed. We should be trauma informed, stress response informed, and neuroinflammation informed. Because the research is more and more overwhelming in showing that what happens in the brain in terms of neuroinflammation and the chemical response from stress has a great influence on mental health. And therefore, this takes us in a new direction. We are going to look at mental health in a different way. And that's the important takeaway from here. When we talk about neuroinflammation, we're talking about the glia cells. The glia cells make up 90% of the neurons in your brain. 90%. For every single pyramidal neuron, you have about 50 microglia neurons. And up until a few years ago, it was thought the microglia were only the glue, because glia is Latin for glue, that holds the brain together. All we thought it was the glia helped the brain stay together so it doesn't fall apart. But now we know a whole lot more about the microglia and the glia cells. There are the autoimmune cells of the brain. They eat tissue, they eat dead cells, they eat bad cells. They do a lot of very important work. And they also support the functioning of your brain. Therefore, if your glia are not healthy, your brain is not healthy, and your mental health is affected. So mental health is really the byproduct of brain health. If we have good brain health, we have good mental health. If we have poor brain health, we're going to have very poor mental health. And this paradigm is gaining a lot of momentum because the research, the evidence shows that that's the case. This is not a new age thing that is fashion now, that is going to, be in vogue for a few months, and then it's going to go away. This is something that's here to stay, because the more we study the brain, the more we learn, the more we understand it. And the most important thing to understand about neuroinflammation is that you have three types of glia cells. You have a healthy glia, or a steady glia, which is what you see here on the left, on the light blue. So that's what a healthy, steady M0 state glia looks like. And for the most part, in a perfect world, that's where a microglia should look like. Now, it's not a perfect world by any stretch of the imagination, and things happen. So if you get a TBI, a traumatic brain injury, or you have emotional trauma, or you have poor sleep, or you get infections like encephalitis or COVID-19, things that attack your brain, you're going to have glia priming. And glia priming is the first step in neuroinflammation. And that means that your healthy glia splits into two. It no longer is an M0 steady glia. It turns into an M1 pro-inflammatory glia and an M2 anti-inflammatory microglia cell. The M1 is related to cytokines, which are inflammatory chemicals. And we have the interleukins, such as interleukin alpha beta, interleukin 6, interleukin 12, TNF, which stands for tumor necrosis factor. And there's a gazillion of them. But what you need to understand is that these are bad for you. They're not good news. And then on the other hand, we have anti-inflammatory interleukins, meaning they are good for you because they fight inflammation. If I'm walking and I bump into a wall, I'm going to get my forehead swollen, my skin is going to swell. But neuroinflammation in the brain doesn't look like that. Neuroinflammation in the brain looks like prime glia. And once you get the brain primed for whatever reason, now you have to do everything within your power to get that brain to make more of the M2 glia and then convert the M1 into M2. And there's neurofeedback has shown to do that. Photobiomodulation has shown to do that. TMS, transcranial magnetic stimulation, TDCS, transcranial direct current stimulation has shown to do that, has shown in the evidence that you can turn M1 pro-inflammatory glia into M2 anti-inflammatory glia. And this is the sequence that the brain follows as we get neuroinflammation. We have a first hit. The most common way of glia priming is a traumatic brain injury, a TBI. You fall down the stairs, you're dropped as a baby, you're shaken as a baby, you're in a car accident, you fall off the bike because you were not wearing a helmet, you're rock climbing, you hit the rock and you're not wearing a helmet, or even with wearing a helmet, you get a traumatic brain injury. That's the first hit. Other forms of hits include poor sleep, poor nutrition, and trauma. Trauma, or PTSD, emotional psychological trauma, is one of the elements that exacerbates inflammation. So you get your first hit and you get glia priming, you get a second hit, whatever that is, and then you get even more glia priming, and then you start seeing the consequences of inflammation in terms of mental health, bipolar disorder, depression, anxiety, obsessive compulsive disorder, ADHD, whatever the initials, you name it, they're all related to neuroinflammation. Now, the other important element to understand here is that healthy people with healthy brains also have a healthy degree of neuroinflammation. So all of us present at this moment have some degree of neuroinflammation in our brain. And the important thing is to check whether it is a healthy degree of inflammation that keeps things in check, or it is neuroinflammation related to mental health and physical health ailments. So we have some symptoms, and we have subtle neuroinflammation and more advanced neuroinflammation. These are the things you have to look for in your clients. Brain fog, such as hazy thoughts, reduced brain endurance, brain fatigue after exposure to certain chemicals, and brain fatigue after eating certain foods. Certain clients will have food insensitivities or food intolerances or food allergies that they don't know about. And that's affecting mental health, and that's getting in the way of your interventions. If you want to do more successful therapy, you need to address nutrition. There's no two ways about it. If your client eats better, if they have an optimal restructuring in their nutrition, your therapy sessions are going to progress more steadily and more efficiently. Now we have, from that, we can go into moderate neuroinflammation if there's nothing that's done about that. We just keep ignoring it. And that's when we see things like depression, the inability to concentrate for longer periods of times. The person feels drowsy and sleepy throughout the day. They're just really, really tired. We find that we have an increased demand for sleep, and we need to sleep more hours, but we don't sleep in a restful way. We wake up tired regardless of how many hours we sleep. We feel the person will feel lethargic and fatigued. There will be lack of motivation, loss of appetite, and the inability to face things, to do things more efficiently. And most of the time, this is the type of client that we get. The moderate, the subtle inflammation, not so much. People think that they can exercise and they can outgrow in some capacity, and then things get worse, and that's when they come to see us. And then we will also see a large percentage of patients or clients with severe neuroinflammation. And it comes in the form of an encephalopathy. It comes in the form of more severe psychiatric presentation, dementia, as neurodegeneration, delirium or psychosis. Many people can go into a coma. Maybe people can present seizures, convulsions. People will have difficulty speaking, and we will have trembling. That goes beyond your essential tremors. This is more in line with maybe Parkinson's disease or some kind of toxic metabolic issue that was not manifesting that overtly, and it is manifesting more overtly when the client comes to see you. So as in conclusion to this first part, we have the neuroinflammation and poor functioning of the HPA axis can cause hyperperfusion, thalamocortical dysrhythmia, and dysregulation in the communication between networks. In essence, they will alter the functioning of the brain, okay? And this should not be treated with talk therapy alone. Talk therapy is not going to dampen, is not going to reverse, is not going to solve the problem of neuroinflammation. That's when we need to incorporate technological options, which is what we're going to talk about now. So for this to happen efficiently, we always have to think co-opetition. As my mentor and good friend Jay Gonkelman says, we need co-opetition, not competition. We need cooperation. And this is better implemented in a multi and interdisciplinary approach. And that means we involve talk therapy, because talk therapy is essential and is very helpful. We involve brain training with neurofeedback, with biofeedback, with photobiomodulation and other neuromodulation techniques. We have to incorporate the lifestyle. And that means your nutrition, your exercise, your sleep, your daily habits that make or break your mental health. And then other functions or other forms of intervention will include functional medicine, nutrition, chiropractic approach. In my 15 years of clinical experience, I learned in the later part of those 15 years, I would say the last maybe 5 to 6 years, that this approach is more efficient. And 5 to 6 years ago, I started incorporating functional medicine, more talk therapy, more supplementation and nutraceuticals, chiropractic approaches into my work. And today, I do not work with a client who does not want to take the multidisciplinary route. If they don't want to work hand in hand with other practitioners, then I don't take that case on, because I know that chances are that they're not going to be as successful, and then I'm going to be the villain. I'm going to be the bad guy in this movie. But if the person can afford to have the time, the commitment, the discipline, the desire, and also the financials to commit to all of this, then I'm willing to work with them. And that's just my personal preference, based on also protecting my reputation as a clinician, and then making sure that, you know, I'm giving the client everything that I can probably get them. This doesn't guarantee 100% success rate, but it does guarantee that you are going to have a higher success rate with your clients. Now, I always like to start with an assessment. And one of the assessments that I love incorporating, excuse me, it's the brain map. So the technical term is QEEG, quantitative electroencephalogram, and it's also known as a brain map, or as a brain scan, or as a brain whatever. There's different designations for it, but what you should know is that we have the ability to scan the brain and look at different brainwave patterns. The other assessment that I incorporate is called the psychophysiological stress profile, which is more commonly known as a stress profile. And this allows me to monitor different body responses, such as muscle tension, breathing rate, heart rate, peripheral temperature, the sweating response of the palm of the hand. And I can do these measurements individually, but most of the time I will combine the different variations, different psychophysiological options. This has very strong correlation with brain metabolism and body metabolism. It helps me understand the client's responses, physical responses to their psychological makeup. So I will understand how the client responds psychologically, but then how the brain responds to that psychological stress, and how the body responds to the physical and psychological stress. And it allows me to do it in a very objective way, okay, with specific data. So now I'm talking about evidence-based elements here. And sometimes I will do a neurocognitive test, which is a computer-based test that will assess memory and brain processing speed. The combination of these three elements will give me a more complete and robust picture of the client, and it will help me understand them better. Therefore, my interventions, the planning of the intervention, is going to be much more robust, much better designed for this person. And then in others, as I said before, we incorporate functional medicine, we incorporate blood work testing for food intolerances, heavy metals, toxic metabolic, autoimmune, because they all have a correlation with mental health. Okay, mental health needs to be looked from a metabolic perspective now. Again, the evidence is overwhelming. This is something that we should not be ignoring anymore. Now, there are several reasons why we want to do a brain map, why we want to get a brain map. One of them is because the brain map provides real answers most of the time. Okay, it gives you objective, evidence-based answers to your questions. Why am I feeling this way? Why am I thinking this way? Why am I behaving this way? Why am I not sleeping well? Why am I sad all the time? Why do I have this obscure thoughts? Why am I such an angry person? Okay, the brain map can help us provide those answers for you. It's a whole person approach. It looks at you as an individual, not as a patient, not as a client, not as a broken person. It looks at you as a human being who needs help. You're seeking our help, and we're providing it to you in the most humane, objective, professional way possible. And the brain map helps us do that. It also helps prevent treatment mistakes. It cuts down the guessing. We're not eeny, meeny, miny, mowing your intervention. We're going with a clear path. We have a navigation route that we're going to follow. It helps determine your brain type. And by brain type I mean how your brain is helping you or is working against you. It's a personalized approach. It can help in the early detection of Alzheimer's and other neurodegenerative diseases like frontotemporal dementia, vascular dementia, Parkinson's disease, etc., etc. It can help us optimize your brain functioning. What we do in the work that we do is we optimize and we stabilize brain function. We're not talking about curing. We're not talking about diagnosing. We're talking about stabilizing and optimizing your brain functioning so that you can feel better. It can also decrease shame and stigma. And it's very well known, especially after COVID, with the lockdowns and everything, how stigmatized mental health is. If you're feeling depressed, you're weak. If you're feeling anxious, you're crazy and you're broken and you're lazy and you lack willpower. Well, the pandemic helped decrease, not in its totality, but it greatly helped decrease those stigmas. And even people who used to be critical of mental health are now seeking mental health services. So I think that's a great thing. And the technology helps you decrease that stigma. It shows that you're a human being with a brain and a body that is working in a specific way. Not that you're crazy, not that you're broken, not that you're weak. You're a human being who needs help. Now, a thing that I like, that I really like, is that it provides objective and measurable results. We're not talking in abstract terms here. We're showing you specific data that we can compare and contrast at different times. We can do a brain map today, a brain map in a month, a brain map in 6 months, 5 years, 10 years, and we can track and trace that progress. And we can show it in an objective way. Okay, this is not data that can be manipulated. It's data that is objective. It allows for multidisciplinary work. I can refer you to a psychiatrist if you need medication, but we can now provide you with the right medication, not guessing the medication. It can help us guide your supplements, your nutraceuticals. It can help guide the better type of therapy that would benefit you the most. Okay, I can work hand in hand with a nutritionist. I can work hand in hand with a neurologist. I can work hand in hand with a pediatrician. As long as the network of professionals is open-minded enough, then we're going to serve you to the best of our capacity. And as I said, we can guide medication now. Okay, the EEG, the QEEG, the brain map helps guide your medication. If you need medication, the prescribing professional can then prescribe the best medication for you. And that means the one that is more efficient, faster acting, and with fewer side effects. Because we know there's a lot of guessing in the pharmacology game. Oh, this didn't work for you. Let's try this one. Oh, it didn't work either. Okay, let's try this one now. And, we roll the dice until we hit the mark. Well, we may never hit the mark. With the QEEG and the brain map, we can move in that direction more efficiently. And this work has to do with helping from two perspectives. We have an individual with a psychological, a cognitive, and emotional component, which can get dysregulated, but we also have the physical component. And part of me loving doing this job is that I can integrate both. And when I work with mental health practitioners, I can help them see how to integrate it. Because unfortunately, something that happens is that certain mental health practitioners do not know, for a variety of reasons, of the physiological component. And they don't know that when they incorporate it and they learn about it, they can be even more successful. They can reduce the time that a client comes for therapy. So, it's not years of therapy, it's not months of therapy, it could be weeks of therapy, and it can make it more efficient. For more severe cases, if your client is being seen you for 5 years and, they're still not progressing the way you want them to, when you do this integrative approach, you can then cut down and empower the client to, go out into the world and be healthier. And so that's why we need to do this. That's why the technology helps integrate it. Again, it's integrating this into your already existing arsenal of tools. And we have some examples here. This is a client, and this is what the brain map looks like. We have in the background here what we call the EEG, the squiggles or the brain waves. And in the blue box here, we have what we call a beta spindling pattern. So it's a specific pattern that could correlate with different things. And we can create color-coded maps that you, as the clinician, can understand, and then that your client will understand. The client doesn't care about the squiggles, really. They care about the pretty color maps, and they want you to help them understand them. So we can teach you how to read this, and we will talk about it at the end of the class, but at the end of the webinar. But in essence, we can teach you how to read this, how to use it, how to interpret it, how to explain it to your client, and how to utilize the brain training to help your client get better. And so we start with the squiggles. Then we can convert it in color-coded maps that shows green, red, and blue. And that means green, the brain is optimal. Red, we have too much, and blue, we have too little. So we're seeing where the brain is working well, and we can further optimize that. Where the brain is not working well, and we can fine-tune that. And it also helps us create images that show us subcortical, deep in the brain. Where is the problem coming from deep in the brain? And guess what? Now we know with certainty what is the region or regions of the brain that we need to to train, How long we need to train them for? How many sessions? How long is each session? Is this a case that requires medication? Or is it a case that just requires supplementation and nutraceuticals? Is it a case that requires maybe both? What kind of therapy approach is more efficient for this client? What kind of nutritional restructuring needs to take place? What kind of physical exercise benefits this brain more? Just by learning to read these lines and look at these images, we can provide our clients with all of this information. And this has room for clinical work in the corporate world, in the sports world, in the artistic. Anybody with a brain, anybody who has a brain can benefit from this. Of course, in varying degrees, but anybody with a brain can benefit from this. So let's talk about some cases here. And I love presenting this because these are cases that came to me because they were doing the therapy alone approach and it wasn't quite working for them. Again, not because therapy is not efficient, but because we were failing to look at the brain and see what was happening there. This is a 16-year-old male that I saw a few years ago. And he was diagnosed as ADHD by the pediatrician. The pediatrician recommended Ritalin as the medication of choice, as the weapon of choice. The parents did not want to medicate their child, and that's where they sought my services. The main or the most salient presentation was ADHD, very hyperactive. This was a very hyperactive teenager. And then as the two comorbid behaviors or behavioral presentations, we had anger and lots of it. This was a very angry young boy, and physical violence against his siblings. Anytime his siblings would pick in on him, he would beat them to a bloody pulp. And it wouldn't matter if it was the brother or the sister. He would beat the sister up equally to his brother. So very, very angry. The type of teenager that would end up in the juvenile legal system, if you will. And upon doing the brain scan, we find that here on the right, we have a epileptiform discharge. Mind you, this boy did not have a seizure, never had a seizure in his life. So when I started picking this up and I started showing it to the mom, understandably so, became extremely concerned. And I explained to her, look, this might not be epilepsy. I'm trained to identify this. I'm not trained because it's beyond the scope of my practice to diagnose it, but I'm going to refer you to a neurologist friend of mine who is very open to neurofeedback and who understands this. And the neurologist explained that it's not epilepsy per se, but the region where the epileptiform activity is coming from is the right frontal lobe, a specifically region called the insula, which is here in red, which points to the blue arrow, and the insula in the green arrow. And that's a region of the brain that's involved in aggression. So every time this boy is getting one of these discharges, his hyperactivity is going to fly through the roof. His anger is going to be unmanageable, and then his physical manifestation is going to be uncontrollable. This is not something that you can eliminate with talk therapy alone. You just cannot. Talk therapy does not make this go away. What was the approach then? Talk therapy or parent training was put in place. Behavioral modification was put in place. The neurologist prescribed an anticonvulsant, and we started doing neurofeedback. That was the course of action. Multidisciplinary work, behavior modification, parent training, pharmacology, and brain training through neurofeedback. We would have never, ever known the cause if we hadn't looked at it. And this is more common than you think. This is really, really common. Now, the mom was obviously frightened, but grateful at the same time that we were able to find this out. And she was glad that she did not introduce the stimulant, because had they introduced the stimulant, it's likely that this kid would have ended up convulsing and seizing at some point, because it's like trying to put out a fire with gasoline, throwing gasoline into a fire, hoping that we're going to put it out. Case number 2 is a female who is 22 years of age. So we have a young lady who got into legal trouble because of poor impulse control. Now, we can look at this from a very superficial perspective and say, well, she had a poor upbringing, she has trauma history, she's a spoiled brat, she's just a loose cannon. I mean, there's many ways in which we can approach this, but I decided to take the approach that I do take now, which is look at her brain and help us understand this young lady more efficiently. And well, what do you know? In the red box, we have activity that corresponds to a very low activity in the frontal cortex. Low activity meaning low blood flow and low oxygen, low metabolism to the frontal cortex. And if you don't know anything about behavior, is that the frontal cortex is extremely important for behavior regulation. If we have poor blood flow, as the squiggly lines show, as the red peaks show, and as the red spots show here, you will know that this person has very poor impulse control, poor focus skills. Okay, they're not crazy, they're not broken, she's not a criminal. She did something that got her into trouble with the law, but she's not a criminal in the strict sense of the word. She doesn't have a rap sheet. It was her first offense. But now we understand that this young lady needs help. This brain needs help. Can talk therapy alone help? No. Talk therapy will help to a point. But if you don't directly impact this through brain training, it's not going to make a difference. Okay. And I know it because I have 15 years of thousands of clients that I've seen throughout my career who tell me, I've done therapy and it has helped me, but it doesn't help me completely. I've done medication and the medication makes me worse. So now that we're incorporating the neuromodulation techniques, we can give this young person a fighting chance of avoiding ended up in prison with a life sentence or maybe on death row because she did something stupid that she wasn't supposed to do because her brain is not helping her out. Okay. And again, we look at the raw data, which is the lines that go up and down, the squiggly lines. We look at the spectral displays and we look at the 3D maps, and that gives us the full picture. Now, would I send this lady to blood work for neuroinflammatory markers? Absolutely, because you can bet that she will have neuroinflammatory markers. You can bet that she will have mitochondrial dysfunction. You can bet that she's going to have metabolic dysregulation. And this is the eyes closed for this young lady. And where we're finding with the eyes closed is that she has in the red circle something we call a vertex wave. And a vertex wave It's a neuromarker. It's a brain signature that indicates that there's a sleep disorder. And we have, along with that, we have stage 2 sleep early on. She's falling asleep when she should not be falling asleep, and the vertex wave indicates we have a sleep disorder. So we have a sleep disorder along with an eyes open recording of a brain that's low on energy. Well, yeah, this lady is likely to get in trouble. And if you pair that with her upbringing, her upbringing maybe wasn't the most appropriate one. So the combination of the two is what we need to address here. But we would have never done that if we hadn't looked at the brain. And third case, to start wrapping this up, is a 12-year-old with OCD, obsessive compulsive disorder, who had a very hard time eating with his hands. So he would get extremely nauseated and grossed out when he ate with his hands. And if he saw other people, his parents, friends eating with their hands, that would induce vomiting. Okay. A lot of cursing and foul language, suicidal ideation, Asperger's traits. And this is, we did counseling, psychotherapy plus neurofeedback, and we've done 80 sessions to date. So this needs to be updated, but we've done 80 sessions to date. And what I want to show you is the brain before and after. At the top is the brain at baseline. You can see this red spot here in a region of the brain called the anterior cingulate gyrus, which means it's the region of the brain that makes this young boy very stubborn and fixated. Hence the OCD traits, hence the cognitive inflexibility. And then if we look at his alpha brainwaves in the back, it's too much. Red means too much. So this brain has too much activity here and here. And now the bottom picture is his brain after 40 sessions of training. 40 sessions is roughly, at the rate of speed we were training him, was about 4 months. So this is about only 4 months of training. Look at the reduction in activity at both his anterior cingulate gyrus and the alpha waves, especially in the posterior region of the brain. Now, it means that this brain is rewiring itself more efficiently, and now we need to correlate it with behavioral changes. And what the parents are reporting is that, he now eats with his hands. He can eat with his hands and watch other people eat with the hands. The F-bombs have essentially and virtually disappeared. It was an F-bomb every 2 to 3 words. Now they're gone. Social skills are more efficient, doing better at school. So this is the work of everybody. This is the brain training plus the psychotherapy. But again, we would have never known that had we not looked at it. And the displays, again, help the client visualize it more efficiently. It helps the client understand what we're telling them. Now, it's also a skill that you need to develop to explain it in layman's terms. You don't want to sound too eloquent and pompous when you're describing this to the client, because the client doesn't care how eloquent you sound. They just want to know if you're going to make them better or not. So part of the trainings that we do is we can teach you how to read this and then how to deliver this to your client in a very personable yet professional way. Okay, let's talk about stress now. One of the things that we can do is a stress profile. And again, the stress profile will allow me to measure different psychophysiological modalities. In this screen particularly, we can see the pulse profile for the person. We can see the breathing speed for the person. We can see in the blue the respiration rate, and to the right we have the digital value for that. In the red line represents the heart rate, and to the right we can see the digital value for that. The skin conductance, or the sweating coming from the palm of the hand, it's in the amber or orange line, and you can see the value to the right. And the peripheral temperature, we can look with the red line, and then to the right you can see the digital value represented in Fahrenheit. You can also see Celsius if you're in a region of the world that use the metric system. Now, at the top, we can look at the muscle. In this case, we're looking at the blue line represents the trapezius in the back of the neck, and the green line represents the trapezius in the the upper trapezius and the back of the shoulders. And we can locate the muscle electrodes in whichever muscle group we have. It doesn't always have to be the trapezius. And we subject the client to minimal stress tasks. We start with a baseline recording. Then we subject them to a mildly stressful mathematical task. Then we let them recover. Then we have them talk about something that that created stress, and then we let them recover. This particular one is the stress profile of a young person who I did here in Singapore who got into trouble with the law. Because when he was doing his national service, meaning his military service, he tried to sell marijuana to an undercover cop. And if you know anything about Singapore, is that drug offenses are taken very seriously here. There's a minimal amount of illegal substances that you're allowed to carry. Not allowed, but if you get caught with a minimal amount in Singapore, you go to jail. You do prison time. But if you go over that, you automatically will get the death penalty. And once you get the death penalty, it's very difficult. It doesn't matter who vouches for you and how many appeals you get, you're going to go to the gallows, because I think that's what they do here. So this young man got into trouble for trying to sell marijuana to an undercover cop in the military. And if you look at this segment here, I was asking him to talk to me when he got arrested. And he was talking. You can see the sweat in the palm of the hand to climb dramatically. He was very anxious talking about it. The temperature drops. His hands are getting cold, which is a sign of stress. Look at the muscle in the back of the shoulders. He's getting very tense talking about this. Now I have a more objective, clear image of what it looked like for him and what I can do to help him out. And they came to me because it was court mandated that he did some kind of rehabilitation process. And they got referred to me through somebody. And we ended up working with him to the point that where he ended up not doing prison time. He ended up being on parole for some time. The charges got dropped, and now he's going to the university. He's getting straight A's. So we were able to help this young man turn his life around by understanding these processes. Now, there was psychotherapy involved as well, and the other holistic interventions. But what I'm going to say is, from my end, I'm very proud to have been able to help this young person with these technological tools. The stress profile will give you the data with objective measurable numbers. So again, if you're into research as well and you want to publish this data, then you can do that. Okay, this is not something that we're making up. This is something that is coming from your body and your brain. This is a professional boxer here in Singapore. She authorized me to publish this picture. She's very happy with the job that we've done. This is me doing a neurofeedback session with her. I don't know if you can see in the background here, but as she's sitting, she has a sensor at the top of the head, and we're using a specific screen to do a video game. And this is her posting on her social media. So again, this is she's authorized me to help out with by providing this, making this public. And she's very public about it. She's been, and this is an unsolicited, by the way, this is an unsolicited response from her, an unsolicited testimonial from her. So it's just on her own volition. She did this, she mentioned us, and we're happy with the advertisement, but otherwise, we wouldn't have done any way to break confidentiality. So I just want to clarify and get that disclaimer out there. So in conclusion, as we've navigated through this waters here, we can tell that adverse childhood experiences, adverse life experiences, and adverse childhood experiences will disrupt normal and healthy neurodevelopment and will lead to neuroinflammation, which will lead to poor mental health outcomes. Neuroinflammation compromises brain functioning, which compromises brain health, which compromises mental health. So mental health is really related to brain health. This dysregulation cannot, in many cases, and should not be addressed with talk therapy alone. We need a more integrative approach. And obviously, we can talk about these options here. There are ways to map and scan the brain objectively, safely, in a non-invasive way, and in an affordable way. Again, if you're interested, you can talk to Kelly Feely at Successful Practitioner, and he will help you navigate through this process of being a newbie, a rookie into the field, how to set up a successful practice, what type of equipment to buy, and I will talk a little bit more about that. So brain stabilizing brain training plus talk therapy is always more powerful. The combination of interventions is always more powerful. There's no standalone panacea that helps the client. Medication alone won't do it. Nutrition alone won't do it. Therapy alone won't do it. And multidisciplinary approaches are key. So that's very, very, very important to understand. Multidisciplinary approaches are key. And my invitation is for you to do that. In Mind Out and Successful Practitioner run very successful trainings. I'm part of the team of educational instructors. And since we're talking about it, just to let you know, there will be trainings in biofeedback and neurofeedback in June, July, and September. So you can go to successful-practitioner.com to look at the dates, to register. You can book a 25 free-minute consultation with Kelly, who is top-notch. Kelly will help you out and get you ready to go. Now, having said that, here's some of my social media. That's my email. If you have any questions, of course, feel free to email me. My channel, my YouTube channel, Santiago Bryant, which you will easily identify. I have some nice pictures of brains. And the mindlab.com is being revamped. So if you go to the website, you will see all the information that's being revamped. And you can find me as NeuroSantiago or the mindlab.sg on Instagram. And with that in mind, I want to thank you. This is a lot of fun doing this. So again, remember successful-practitioner.com. There will be trainings in June, July, and September. You can go there. There's the dates are there. It's a very nicely designed website, and you can talk to Kelly, who will provide you with all the information. Naomi is gracefully typing the website on the chat in case you cannot understand what I'm saying. And just to clarify. Thank you, Crystal. I'm glad that you found it useful. And if you're interested, we invite you to join us in this wonderful world of neurofeedback and biofeedback.